Well, here we all are, having ourselves a massive existential crisis. I'd like to say we're in a position to look back on it and have learned a bunch of things, but we're still in it. I think it's too soon to reflect. But I am aware that we all are doing this together, and there's an opportunity here. And just like our patients and their families teach us when they're having an existential crisis, it's painful, it's hard, it's confusing, it's scary, but it's not just those things. Thanks to the basics of human touch, acknowledgement, bearing witness, seeing each other, this is how we get through these things. This is how we learn. This is how we learn what within us can go and what must stay. So extra hearty thanks to our patients and families for leading the way. And we need to follow now. And it also gets us at something else that's happening right now, which is who's showing up. You know, the essential workers. It's a beautiful thing to see, and it's also obviously very difficult. It's coming at great cost. But in that math, I think we're learning what is essential. Well, what is essential is that we show up. Yeah, especially in healthcare, we bring these skills, these medical skills, these things we layer on top of our being human beings, but they're never more than us being human beings. Showing up, being there for each other, bearing witness, the small things, which as we know in the end, aren't so small. So a huge shout out to our essential workers, not only for showing up, but teaching us all what is essential within us so that we can be essential ourselves. One more thing to point out and really actually delight in, especially for those of us involved in serious illness care, this community of C-TAC. I think one of the things we've all suspected for a long time is that all healthcare is palliative care at its basis. That good care is palliative care. That this specialty has come around to remind healthcare of its basics, of its fundamentals. And we're seeing that play out now. So I'm also excited to see this recognition, and it's not just recognition, but this realization that indeed healthcare at its best, all healthcare at its best, is palliative care.
Let the words of my mouth and the meditations of my heart be acceptable in thy sight, O Lord, thy strength and my redeemer. It's one of my favorite psalms. And it is a psalm that reminds me as clergy, the responsibilities that I have every time I walk into the room. When we provide a service to those that are enduring hardships of life, we have to be careful what comes forth from our mouths and what is in our heart. And so whether or not we have a faith tradition, one thing remains for sure, is the service we do impacts those in whom we have the privilege of touching. Even amidst COVID-19, we're in a moment where we cannot touch, but it's still a need for those who are receiving care to be touched. So we have to be innovative and creative. And so a part of this program is honoring essential workers. And so we thank you for your service. We thank you for your continual dedication. We thank you for the ways you walk into the room and the ways you speak through telehealth or through media or through the telephone, that you are patient, that you're kind, that you continue to be genuine, you continue to be sincere and offer the greatest care. We salute our essential workers for C-TAC 2020.
Hello, everybody. My name is Rabbi Daniel Stein. I'm from Bloomfield Hills, Michigan. And over the last year, I've had the privilege of beginning to know a little bit more about C-TAC and its work. Today, we honor the essential workers, or some of them across the country, who in the midst of this pandemic of COVID have reached out to those in their care and brought them love and caring and kindness. Let me read their names. Dr. Tim Campbell, Chief Medical Officer for Gallagher Home Health. He is also a medical officer for the federal DMAT and has been deployed greater than 5 times in the last 6 months to care for COVID patients at Travis Air Force Base in the beginning to air medical evacuations to hospital decompression missions. Next, Melaine Barco in radiology at George Washington University Hospital. A sacred passing located in Seattle, Washington. This is for all instructors there, specifically LaShawna Williams, Summer Deigel, and Carrie Redway. Micaela Corazon, Crisis Line Director of Suicide Prevention and Crisis Service of Tompkins County. Dr. David Barile, Founder and Chief Medical Officer of the Goals of Care Coalition of New Jersey. Dr. Barile is also the Director of Palliative Medicine Services and Medical Director of the Acute Care for the Elderly Unit at Penn Medicine Princeton Medical Center and Medical Director at Princeton Care Center, Skilled Nursing Facility, Greenwood Hospice, and Golden View Memory Home. Danielle Wolfrey is a registered nurse serving in the Valley Health Winchester Medical Center COVID-19 unit in Winchester, Virginia. E. Paulette Sheffield is Program Director for Leadership Council for Healthy Communities, a DC-based organization of clergy leaders and medical professionals working to help eliminate health disparities and to promote health equity. Mrs. Moga Negam, President of the American Muslim Senior Society. Mr. Carlton Hayes, Supervisor in the Environmental Services Department at Memorial Sloan Kettering Center. Francesca B. Messiah, MS, Senior Marketing Associate, Community Relations at Kaleda Health and host and producer on WUFO AM Power 96.5 FM, Great Lakes Health Program. In addition, she is the Executive Director of Near East and West Side Task Force not-for-profit organizations. Through collaborative partners, provide health and education programs for underserved populations for Buffalo's African American and Latino communities. Imam Yusuf Hassan, BCC, is the first board-certified Muslim chaplain in the Association of Professional Chaplains. He works at Memorial Sloan Kettering Cancer Center, caring for the human spirit. Julia Hollander, RN, a labor and delivery nurse at Hutzel Hospital in Detroit, and now at Henry Ford Hospital in West Bloomfield, Michigan. Dr. Tara Defoe Griffin, who supervised the feeding of the hungry throughout Michigan, as well as their housing and coronavirus testing. Dr. Defoe Griffin, who herself is a coronavirus survivor, is also a high-level executive supervisor for Detroit, Michigan Mayor Mike Duggan's administration. All of these people represent just a few of those who care for those in pain throughout our country. Today we salute them and we congratulate them.
My name is Imam Yusuf Hassan, and I am the first board-certified Muslim chaplain in any professional organization in this society. And I'm truly honored to work along with some great people in my community, as I'm a member of the great Malcolm Shabazz Masjid, the historical Malcolm Shabazz Masjid in Harlem, New York, founded under the leadership of Imam Walisuddin Muhammad, and now under the leadership of Imam Ezekiel Mueed Pasha. And I'm responsible for caring for our sick and our weak in our community, especially the elderly. We look out for them on many, many levels, especially during this time of COVID, where the health disparities are afflicting our community at a higher rate than many other communities. I'm honored to walk with them through this journey and care for them at the end of life and support their families after they're passing along. I work with C-TAC as one of the coalition members, working under the leadership of the advanced care team. And I'm honored to work with C-TAC, which has a group of great community leaders, religious leaders, and people that care for our community. And I'm concerned about the health disparity of all communities, but especially the African-American community. We have an opportunity, since COVID has afflicted this society and the world, to make a great impact on bridging the gap between the health disparities in this society and probably throughout the world. And I think it's important for people to realize that as a healthcare provider myself, I have had the opportunity to work in some of the greatest facilities in this country. I specialize in pediatric care as well as for our seniors and our others. And I'm supported by a great team of healthcare providers where I work at here at Memorial Sloan Kettering and other healthcare facilities in this city. It's a blessing to be there for those who need us the most, the sickest of the sickest. And it's important for us to care for ourselves as well in this process as healthcare providers. We ask that each one of us take time out to care for your family, care for yourself especially. Be who you are. And we ask that the community continue to be who they are. And we hope as members of C-TAC to help transform these communities into a better form and a better care for our seniors especially. We thank them for allowing us to be a part of their journey. Many are afraid, many are confused, but we are here to help make this transition from being a healthy person to become an elderly person and to transform into the next form of life. We thank God for the opportunity to serve each and every one of them. And we thank those who support us in this tremendous work of caring for our communities. Thank you all. Be safe. Peace and blessings.
I first became interested in the area of advanced care decades ago as a young pastor. I would go to a desperately ill person's family and say, maybe you should talk to the doctor about hospice care. They would go to the doctor and come back and report that the doctor was indignant that a pastor would suggest that it was appropriate time for pastor care. It was way too early. 2 weeks later, I was doing a funeral. Things have improved, and our approach to advanced care has changed, but we still have such a long way to go. Let's face it, there's a big difference between dealing with the maladies of the body and helping a person deal with long-term implications of living with advanced illness and ultimately death. That's why I believe so much in an interdisciplinary approach to this issue. Our medical, mental health, social science, and faith leaders all need a strategy that brings them together for the well-being of the patient. The totality of being human is so much more than a body. Even within the religious world, we have so much work to do. We have some amazing institutional chaplains, but they are often spiritual strangers to patients. For those patients who have meaningful relationships with local clergy, that is the clergy person they want to talk to. But local clergy are on a foreign setting when they enter the institutional setting. That setting can be anywhere from openly hostile to benignly tolerant. Rarely is there any strategic planning and programming to help bring institutional chaplains and local clergy together in any meaningful way. faith communities can play an important role in advanced care by recognizing and celebrating caregivers. There are numerous examples of how caregivers often become self-aware of their status as a volunteer caregiver when a faith community recognizes such caregivers. Often, this is the impetus for them to seek and find the assistance they so desperately need to meet this challenging task.
My name is Dr. Gigi El-Bayoumi, and I'm from the George Washington University School of Medicine and Health Sciences. I'm a professor of medicine there, and I'm also the founding director of the Rodham Institute, which is dedicated to improving health equity in Washington, D.C. I'm a general internist, so when COVID hit, that meant that I was taking care of patients in the hospital for a week during the peak of our COVID in DC, which was in May. And that was tough because I lost one of my very long-time patients, and to have him be alone in the hospital without his family comforting him and him being afraid, but ultimately dying peacefully was something that as a physician, it was difficult for me to reconcile, because I was taught, I believe, that our calling as physicians or clinicians or healers of whatever type is to bring comfort even during times of distress. We may not always be able to achieve cure, but certainly comfort and healing and bringing peace and kindness and love is really part of what I believe is our mission. Well, at the end of June, I faced my own diagnosis. I was diagnosed with kidney cancer, and I'm gonna be fine. I do have a tumor, it's large, but I'm getting chemo, which is what's gonna be necessary to get it taken care of. And, you know, facing a cancer diagnosis or any other kind of potentially life-threatening diagnosis is not easy, but kind of COVID obviously adds a completely different layer. And I've been through cancer before about 15 years ago, and that was tough. But I think that what's been making this more difficult is the social isolation. But just like I faced the cancer 15 years ago, I'm so moved by the people that are taking care of me. And yes, doctors are great. We get a lot of the credit for a lot of the work that happens behind the scenes, or the work that especially nurses do. But let me tell you who I appreciate. I appreciate my doctor, sure. He's terrific and very kind. But I also appreciate the nurses. The nurses, I believe, are the angels on earth. And yesterday, I had a scare. I thought I had an infection on my arm. So I had to go in to get an ultrasound into the hospital. And of course, when you go into the hospital, you know, you're taking that extra risk because you just don't want to be exposed to COVID patients. The woman that's the ultrasound technician took me back, and just with the most gentle of hands and the most reassuring of voices, I forgot that I was there to get a test. She was so kind and so generous and so gentle. I had my procedure, and thankfully it was not an infection. It was just a superficial blood clot that was causing the redness and the pain. And I'm going to get emotional, but it's okay. It is people like Ms. Darlene and all the other unseen people that really bring care to us at our most vulnerable times. As I was going home, I passed the security guard and said hello to her, and I passed one of the custodial workers who was cleaning, said hello to her, because I know that they are just as important as the radiologist who gave me my results. It's everybody. We're all spokes on a wheel. None of us is more important than the other one. We are all there to care for people. So it's the patient, it's the family, it's the community that's in the middle, and the rest of us are spokes in the wheel. I just happen to be in the middle of that wheel right now. I'm going to be fine. I'm finishing up in another few weeks, but I will always remember and be thankful of the love and care and just grace that I've been shown.